Minimal Care by Jones H.M-MBA DMS. Introduction. One of the most difficult realities that the nurses face is that some patients call for special care, more attention, whilst others call for minimal care, less attention. Different patients' clients have different nursing needs depending on their conditions and deficiencies. Some will need special care, more attention, whilst some may just need assistance in performing some of the universal self-care needs. Patients that have the ability to perform most of the universal self-care needs will be said to be in need of minimal care. Definition. Minimal care is nursing interventions where the patient is able to perform some of the activities according to his ability. In this type of care, the nurse and relatives can assist in other activities. H.M., 2002. Not all patients require minimal care. However, patients with conditions such as eye injuries, uncomplicated malaria may need assistance in the following self-care activities. Maintain body hygiene, bathing. Wound dressing. Nutrition, feeding. Elimination, voiding or opening bowels. Maintaining a safe environment. Mobilization. Factors affecting minimal care. 1. Change of environment. Strange environment, hospital ward, may hinder the patient from self-care activities, e.g. a patient refusing to eat food prepared in hospital or refusing to use water-borne toilets. 2. Culture, values and beliefs, the belief that when one is sick he should not eat and cannot perform self-care. 3. Age, children may not have the capacity to perform self-care fully, e.g. feeding, bathing. 4. Motivation. A demotivated and frustrated patient, such as one in denial or anger stage of terminal illness, will fail to perform activities such as bathing, feeding. 5. Neuro-muscular function. A patient with paralysis of the limbs will fail to feed him/herself or to walk normally. 6. Energy levels. A patient who is weak due to severe dehydration may be unable to bath himself. 7. Cognition and perception. If one does not have the knowledge of the importance of that particular activity, they may not perform it. For example, the mentally challenged patient may refuse to bath due to cognitive and perceptual derangement. 8. Resources. Without necessary resources, such as wheelchair, crutches, patients may fail to perform self-care activities. Conditions that require minimal care. There are a lot of conditions that require minimal care, such as fractured femur, radius ulnar. Eye conditions such as glaucoma. Fracture of the clavicle. Uncomplicated malaria. Soft tissue injury, e.g. sprain. Below knee amputation. Levels of minimal care. Basically, there are five levels of minimal care, and these include: Level 0, patient is independent in self-care activities. Level 1, patient uses equipment or devices to perform self-care activities independently, such as a walker, crutches, wheelchair, etc. Level 2, patient requires assistance or supervision from healthcare provider or support person to complete self-care activities, e.g. patient on traction will need bedpan. Level 3, patient requires assistance or support from others and uses devices or equipment, e.g. patient who needs a nebulizer. Level 4, patient is completely dependent on another to perform self-care activities, e.g. patient with quadriplegia. Minimal care of a patient with fracture of the femur. Fractures of the femur can occur at several sites, shaft or in the region of the knee, supracondylar and condylar. The patient will usually present with swollen, deformed thigh. For example, patients with compound fracture may initially need wholly compensatory nursing care due to the impending shock because of hemorrhage. However, when patient stabilizes and become more independent, minimal care can be applied. Nursing management according to OREM'S self-care model. Dorothea OREM, 1971, developed a definition of nursing that emphasizes the client's self-care needs. OREM defines self-care as a learned, goal-oriented activity directed toward the self in the interest of maintaining life, health development and well-being. Potter and Perry, 2005. The goal of OREM'S theory is to help the client perform self-care. OREM'S model identifies 3 systems of nursing activities that are designed to meet the individual's self-care requirements according to the extent to which self-care action is disrupted. The wholly compensatory system, partly, minimal, compensatory system and the supportive educative, developmental system are the levels of care in the OREM'S self-care model. According to OREM'S self-care model, there are three main categories of self-care requisites. 1. Universal self-care are all those activities required of all individuals to maintain integrated human functioning, e.g. feeding. 2. Developmental self-care requisites are those activities that are required as a result of developmental processes, such as aging. 3. Health deviation self-care requisites are those activities that occur as a result of disease, injury, disfigurement, disability or medical diagnosis and treatment that require that changes be made in the person's routine of self-care depending on the nature and extent of requisites, e.g. amputation of lower limb versus sprain. Applying this model, a patient with fracture of the femur can receive a minimal, partly compensatory care as follows. Maintenance of a sufficient intake of air. According to OREM'S self-care model, a patient with fracture of femur will not need help in breathing. Maintenance of sufficient intake of water and food. The patient may not be able to walk but can hold the cup of water and feed him or herself. There is need for the nurse to assist the patient to hold the cup if unable. Provision of satisfactory elimination. There is special care needed for this patient in terms of elimination. The nursing requirements for this patient will be to provide bedpan and/or urinal to promote elimination as well as maintaining privacy. Balance between activities and rest. The nurse places a pillow in between the legs to keep the leg in an abducted position. The nurse orients the patient on the repositioning techniques to prevent pressure sores and malunion. Vigorous activities are limited for 3 months. Balance between solitude and social interaction. The client can be admitted in the orthopedic ward, and mainly these patients do stay long in the orthopedic ward. Social interaction should be encouraged. Prevention of human life hazards, maintenance of body function and well-being. The human life, body function and well-being as a whole is not so much put at risk of hazardous agents. The patient is usually fully aware of his environment and other things that can injure him or her. However, hazardous agents such as slippery floor should be avoided when ambulation commences. Maintenance of normalcy. This is important in the promotion of body functions and development of an individual client within a social group in accordance with human potential and known human limitations. The condition of the client can be explained in order to give emotional support. Client is told that fracture of the femur can heal and patient can come back to the previous way of life. The client will still be able to perform social roles. Nursing care plan. The following three nursing problems are identified as examples: pain, anxiety, inadequate personal hygiene.